Hi everyone, my name is Emma Quinn and I'm a mental health advocate and I live with bipolar. Today I want to talk to you about managing your anxiety during the COVID-19 outbreak. Please know what you're feeling is completely normal and totally justified. You are not alone in feeling anxious about this situation and the things that you can't control. These are just some tips and tricks that I've been using at home to help manage my anxiety, and I thought that I would share them with you. Number one, keep your brain busy. This is really important because once we get into our own head, that's usually when trouble starts to brew. So, whether it's coloring, doing puzzles, games with your family or roommates, I know I've been doing a lot of those, or playing video games and binge watching Netflix. If you haven't seen The Tiger King, I highly suggest it. You will never know what's going on in that show, and so it'll definitely keep your brain busy. Or maybe learn a new hobby right now. Has a guitar been staring at you? Maybe you want to learn how to paint or knit. I know it can be overwhelming at the time, but put your mind to good use right now. Number two, focus on what you can control. There are so many things going on in this world that we can't control right now, and it's scary. But focusing on what we can control is going to help ease that anxiety. Whether it's focusing on how often you're leaving the home, making sure that you only are going for essential needs, whether it's what you're going to have for dinner, you can control that. And what you're doing with your time at home. We have all this time on our hands. What are we doing with it? Make a plan for it and stick to it. Number three, stay connected to family and friends. I know that there are lots of people that love you and care about you and would love to hear from you, whether it's phone call, text message, or even a video chat via Zoom or Skype. These are great platforms to stay connected. Remember, physical distance is not the same as emotional distance. So, although we're keeping our physical distance away from people, we emotionally still want to stay connected. Many groups have also changed to an online platform, whether it's AA, NA, coffee groups, book clubs. Either way, if there was a group that was meeting before, see if they're interested in meeting via Zoom. Lots of places have moved to an online platform, so ask around. Number four, go outside. Now, I think outside is great for everybody's mental health. So, getting outside, whether it's going for a walk if it's safe in your neighborhood, or even just getting outside for a few deep breaths of fresh air will help keep you grounded and put your mind in the right space. I know it just snowed 7.5 inches here last night, so going for a walk might not be something that I can do right now, but you better believe that I'm going to get outside and at least get a few fresh breaths of fresh air right now to help me stay grounded. And number five, I think that this is the most important one for me at least, but try getting into a routine. There are so many things that are uncertain right now that this is our new normal. We have to figure out what we're going to do with this time. So adjusting your schedule and getting into a new routine will help keep you grounded and feel more in control. I know that I definitely have to wake up at the same time and go to bed at the same time, and my morning starts the same way, whether I'm here at work, whatever's going on. But keeping that schedule as close to normal as possible or creating a new one will help you feel more at ease with the situation. Please, if you have any other ideas, leave a comment. Let me know what's working for you. Remember, no two people are alike, and what works for us isn't going to be alike either. Now, if behavioral changes aren't cutting it in your life, it may be time to talk to your doctor about medications. I know medications have played a huge role in my recovery, and I don't know that I can make it through this pandemic without them. So please don't be afraid to reach out to your doctor.